Are you in your 40s and thinking about your first Botox treatment, but not sure where to begin? You're not alone. With so many celebrity frozen face stories online, it's easy to feel hesitant. But here's the truth. When it's done properly, Botox is one of the safest and most effective ways to refresh your face. And it's not just about the forehead. It can be used across the face and even the neck for natural, balanced results. In today's video, I'll break down exactly what Botox is, how it works, and what you can expect from your first treatment. Welcome to my channel. I'm Dr. Sobana, a GP specializing in skin and aesthetics. So let's start off by talking about what is Botox. Botox is actually a brand name for a specific neuromodulator drug. It's derived from botulinum toxin. It's been used safely in medicine for decades to relax muscles. It temporarily paralyzes or relaxes the muscles, which then smooths out the wrinkles formed by muscle contractions. Aside from Botox, there are several other FDA-approved neuromodulator brands. In fact, people often say Botox as a catch-all term, even if they're getting a different brand. So the other brands you may have heard of are Dysport, Xeomin, Jeuveau, Daxxify, and there are loads of other different types of brands available depending on which country you're in. All of them work in a similar way, and the aim is to reduce wrinkles and to reduce muscle contractions. The differences are subtle and mostly related to formulation and how long they last. So Botox is the original gold standard. Results typically start and appear in about 5 to 7 days after injections and can last for up to 3 to 4 months. Dysport is another well-known brand, and it may kick in a bit faster, so often 2 to 4 days, and you see the results last for much longer, between 4 to 5 months. Xeomin is another toxin, and it's called the naked toxin because it's just pure botulinum toxin without any accessory proteins. It behaves very similarly to Botox in its onset and duration. The lack of added proteins may mean less risk of antibody resistance, but functionally you can expect the same wrinkle smoothing results. Jeuveau is a newer toxin. It was approved in 2019 and developed just for aesthetics. Its onset is about 3 to 5 days and the duration is about 3 to 4 months as well. And then there's Daxxify. This is the newest neuromodulator, which was approved in 2022. Daxxify uses a unique peptide formula instead of human or animal proteins, which gives it some advantages. It kicks in faster, within 1 to 2 days usually, and lasts significantly longer. Clinical studies show Daxxify's effects can last on average about 6 months. This longer lasting effect has its advantages and disadvantages. It means less treatments per year, but it can be pricey because of that reason. And the downside is if you have any complications, so any side effects where you've got lidtosis, so a droopy eyelid, you have to wait 6 months for the effect to wear off. For a first timer, any of these brands can deliver great results, so you don't need to stress about picking the perfect one. All are proven to get the job done. The key takeaway is that all of them relax muscles and give the same cosmetic effect. In this video, I'll mostly say Botox, but the information applies to all these neuromodulators. So how does Botox work? It basically works by temporarily blocking the nerve signals that tell your muscles to contract. And when injected into the targeted facial muscle, Botox inhibits the release of acetylcholine, a neurotransmitter that nerves use to trigger muscle movement. When the signal's blocked, the muscle stays in a relaxed state. As a result, the overlying skin isn't being creased repeatedly by muscle contractions, so the existing wrinkles soften and new wrinkles are prevented from forming. Think of those persistent frown lines between your eyebrows and crow's feet around your eyes when you smile. These are called dynamic wrinkles, and this is formed by repetitive expressions, so repetitive muscle movements. So when we inject Botox, it relaxes those overactive muscles so the skin has a chance to smoothen out. You just won't be able to make the deep fold or those furrows as strongly. A good injector will target only the specific muscles causing the unwanted lines, but preserving your natural expressions. I never freeze your face unless that's what you request for. So just remember that Botox's effects are temporary, so muscle activity will slowly return after 3 months. Right, so you've decided you want to try Botox. So what should you do next? The first thing you need to do is find an injector and have a consultation with them. Always have a face-to-face consultation with your injector. If you want some tips on how to find a safe and good injector, then you might find this video helpful, where I explain what things you should look out for. Unfortunately, in the UK, aesthetics treatments like Botox fillers isn't regulated, and anyone, and yes, I mean anyone, can attend a 2-hour course and start injecting your face. So it's really important to do your research and find the right injector for you. So many people aren't aware that Botox is a prescription medication and it can only be issued by a qualified prescriber. So that's all doctors, all dentists, and then there are some pharmacists and nurses who can do an additional qualification to become a prescriber. So if you decide to go to a beautician or a non-prescribing nurse or pharmacist, then it's a legal requirement that the person prescribing you the Botox must see you in person and assess you face to face, so they can see if it's safe for you to have the Botox and if it's actually suitable for you. If this isn't happening, then you really need to question this with your injector. If they are cutting corners with this legal requirement, then you need to start asking questions about what other protocols might they not be following. Botox needs to be prescribed specific for a patient. So you can't buy a stock of Botox bottles and then treat patients like you would with other skin treatments. It has to be specific to a patient, and this way it ensures the toxin actually comes from a UK registered and licensed pharmacy. A few months ago, there were 2 large outbreaks in the UK linked to imported unlicensed toxins, resulting in people ending up in intensive care. As I mentioned, every good Botox journey starts with a thorough consultation. So let me talk you through what happens during my consultations. If this is your first consultation with me, it usually lasts around 45 minutes. And if you're happy to proceed, then you might have the treatment on the same day. During the consultation, a few important things will be discussed. I will start off by going through your medical history. I will ask about your health background to ensure that you're a good candidate for Botox, and obviously to make sure it's safe for you to have. You'll typically fill out a health questionnaire, and it covers any conditions that you might have. It will cover medication, allergies. It's important that you're honest and you're very thorough with your answers, because there are certain medical conditions like neuromuscular disorders. If you're pregnant or breastfeeding, you definitely should not get Botox. As I mentioned before, safety always comes first. And after this, then the second part is discussing your concerns. We will go through what's actually bothering you. Is it your forehead lines? Is it the 11s between your eyebrows, your crow's feet, or maybe all of the above? Once I've listened to your concerns, I will then examine your facial expressions to see how the wrinkles are formed. This way, I can tailor a treatment plan that's unique to your face. The third part is education and going through the options with you. Just remember, consultations is a two-way conversation. So once you've shared your concerns, I will educate you on how the Botox actually works and what it can and can't do. It's important to set your expectations because there are certain lines and wrinkles and skin concerns that can't be fixed with Botox. I always encourage my patients to ask questions. A good provider will happily answer them. You should always leave a consultation knowing the basics of the procedure, the cost, and the plan. I will also discuss if an alternative treatment would be better. Sometimes Botox isn't going to achieve the results that you're expecting, so I might discuss other treatment options. For example, derma fillers might work better for deep wrinkles, microneedling to help improve skin texture, and polynucleotides for collagen banking to help maintain the effects of Botox for longer. Remember, you should feel comfortable and well informed. If not, it's okay to seek a second opinion. This is your face at the end of the day, and a professional will respect that and address your concerns, and they should not be pushy. Always feel comfortable to walk away. And the fourth part is the consent. So we always make sure we fill out a consent form. Informed consent is more than just a signature. It's making sure you fully understand what you're agreeing to. So don't be shy about clarifying anything that sounds scary or confusing on the form. Common points covered on the consent form will include things like Botox is not permanent, possible side effects, including things like redness, bruising, headaches, and obviously rare complications like eyelid droop. We'll go into these in a bit more detail later on in the video. Once you're comfortable and you're happy to sign the consent form, we can then proceed on to the final stage, the photos, which everyone hates. Every clinician will take photos before they start treating you. The photos are a helpful reference to track your results, and they're usually kept private unless you've given permission to use them for educational purposes or for social media. It might feel a bit awkward to do this mini photo shoot, but trust me, when you do the before and afters and compare the pictures, you'll be really pleased. But that's not just the only reason, it's a requirement for insurance and also our indemnity policies. Right, now moving on to the treatment itself, what can you expect? The procedure is actually quite quick. Even a full face Botox treatment takes about 20 minutes if it's done by an experienced injector. Most patients describe only minimal discomfort, often just a small pinch with each injection. So often most injectors won't use any numbing cream. Obviously we'll cleanse your face using a good alcohol product like Clinisept, and then we mark up your face with a removable pencil so that we know where exactly we're going to be injecting you. I always ask you to make certain expressions so then I can pinpoint the correct areas of movements. So it does feel like a bit of a facial workout because you'll be doing the repetitive movements quite a few times during a consultation. Right, this is an example of a Botox needle. As you can see, it's a very tiny needle, very thin, and often you don't have to insert the entire needle into the muscle. So some injection sites are superficial and some where full needle depth is necessary. But as you can see, it's very thin and very small. Immediately after injections, you might notice some small raised bumps on the skin, just like mosquito bites where the injection sites were. And these typically go down within 10 to 30 minutes. They often disappear before you leave the clinic, so you won't look like you've had anything done. Before you leave is the serious part. This is when I go through some aftercare instructions with you. These are important so that you can get the best results and avoid any side effects. One of the great things about Botox is that there is essentially no downtime. Unlike surgical procedures, you don't need to recover at home, so you can go straight back to your normal daily routine almost immediately. That said, there are a few precautions to take on day one after the treatment. So as I mentioned, immediately after the treatment, you will notice some mild redness, a few small bumps at the injection sites, and these bumps will disappear within a few minutes or sometimes up to an hour. Some people might get a bit of bruising, so this can happen at any time when the needle goes in or as a delayed reaction the next day. The worst areas for bruising are generally around the eyes, where there are plenty of capillaries. To try and minimise the risk of bruising before your Botox treatment, try and avoid things like aspirin or ibuprofen up to a couple of days before the appointment, and avoid alcohol because these things just increase the risk of bruising and also increase your risk of bleeding as well. About 1 in 10 patients complain of mild headaches after Botox injections. And this could be because of the tension that you're putting. So when the injections are going in, you're quite sort of tensed and tight, and that clenching of your muscles then can trigger a headache. This usually settles after a couple of days. A common instruction that most people get advised is not to lie down flat, especially face planted into a pillow for the next 3 to 4 hours. You essentially just have to stay sitting upright for a couple of hours. Avoid any massages, facial massages, avoid yoga where you're going to be sort of doing a downward dog. This is just a precaution to prevent the toxin from migrating before it gets to bind to the actual target areas. In the same way, avoid putting pressure at the injection sites or rubbing the injected areas for at least 24 hours. You don't want the Botox to spread into places where you don't want it to take into infect and then cause possibly a side effect. This is why it's important that when you cleanse your face after a Botox treatment or putting on your morning makeup the next day, just be really gentle and that you're not doing any deep massage movements into those muscles. It's also recommended to skip strenuous exercise for about 24 hours post-injection. Elevated heart rate and blood pressure from a hard workout could increase your risk of bruising. Also avoid heavy sun or heat exposure like saunas or hot yoga for at least 24 hours since the heat can promote flushing and bruising. Basically, just take it easy for the next 24 hours. Some injectors say that exercising your treated muscles like frowning and raising your eyebrows repeatedly in hours after the Botox treatment can actually help for the uptake of the Botox. There's no firm evidence for this, but I guess there's nothing to lose. Right, the key message though is not to expect to walk out of an appointment completely wrinkle-free on day one. Botox is not immediate, it needs a little time to work its magic. Typically, you'll start to notice the treated areas becoming smoother in 5 to 7 days as the muscles gradually relaxes. Full results are usually visible by around 14 days. And this is why I always schedule a follow-up appointment in 2 weeks' time. The check-in is quick but valuable as I can assess your results. I can see how much your movement has reduced. I can take after photos so we can compare them to your befores, and if there's any small tweaks needed, for example, a certain muscle might not have taken up the Botox as much as the other side, so we can make a few adjustments here and there. Not everyone needs a touch-up, so don't expect more Botox at your review appointment. It's also a great chance for you to give feedback or ask any further questions now that you've gone through the experience. By this 2-week mark, you should be loving your smoother, rejuvenated and refreshed look. Many patients in their 40s say it makes them look more refreshed and less tired, like they've had a good night's sleep. Often, friends will notice that you look great, but won't immediately guess it's Botox, which is the goal really. It's just a natural and well-rested appearance. As I mentioned before, Botox lasts for about 3 to 4 months. This can really vary depending on the individual. By the 3-month mark, you're likely to notice the movement is returning and wrinkles are gradually coming back as the muscle regains function. Some people, especially first-timers or those with weaker muscles, might enjoy results for closer to 4 to 6 months before they fully return. On the other hand, very active people or those with high metabolism might metabolize it a bit faster and for even shorter than the 3-month period. Everyone's a bit different. Most of my patients come back around the 4-month mark, and some of them do push it to a 6-month mark. It's not necessary to have return on the dot at 3 months to have your Botox treatments. And some of you might be eager to come in for your touch-ups before that 3-month mark, but I don't recommend treating sooner than 3 months. Injecting too often can make it harder to gauge the optimal dose, and you could could slightly increase the risk of developing antibodies, so you become resistant to the toxin. And the other issue is that you get muscle atrophy. This is when the muscles become soft and loses its structure. So it's in a permanent frozen state and never gets a chance to bulk up. And then the skin overlying this muscle loses its support and you just start to look older, a bit like those bingo wings. So the skin is just hanging without any muscle support. So let's talk about the side effects of Botox. So with any injectable treatment, sometimes there are some adverse reactions. As with all injectable treatments, after an injection, you may have some redness, a bit of bleeding, and some bruising afterwards. The sites where you've had the injection can feel tender, and there might be a tiny bit of swelling around those injection sites. Some people can actually feel flu-like or a bit achy after a Botox treatment, especially the next day. This is really rare and usually resolves after 24 hours. And then there's the dreaded eyelid droop. This side effect, which everyone knows about and everyone worries about, is actually quite rare. This happens if Botox diffuses into the wrong muscle or is injected in the wrong spot, and it essentially weakens the muscle that's holding up your eyelid or your brow. The good news is it's temporary, and if it does occur, it resolves after 3 months. There is a prescription eye drop that can be prescribed which can help to improve the appearance of droopy eyelids. This is why it's important to choose an experienced, trained injector who can help to minimise these risks. They'll know how to avoid the danger zones near the eyelid and the brow. And obviously, if they're a prescriber, they can prescribe any treatments or drops needed to counteract any side effects. It is exceedingly uncommon, but if you ever had an allergic reaction to a previous Botox injection, obviously you should never have it again. And this is another reason why you should see a medically trained person to have your injections, because if you do have an allergic reaction, they will be well trained and have access to an emergency drug treatment box, so they can actually deal with an allergic reaction before it becomes life-threatening. Often patients notice changes in their smile and facial expressions due to muscles not contracting as much or in the same way as it was before the Botox treatment. So it's quite a strange feeling at first, but you start getting used to how your muscle movements have changed after Botox. And this is another reason why I never freeze the face, especially if it's your first time, because it can be quite a shock to the system from going from a face that has full facial expression to not being able to do much at all. I often get asked if there are any long-term side effects of Botox. So the two main issues really are muscle atrophy, which I've mentioned earlier. When just over-freezing and not using the muscle at all, the muscle just becomes floppy, which then ages you faster. And then the second issue is only treating one part of the face. A lot of patients who are seasoned Botox users have only been treating the upper face, so the forehead, the frown lines, the crow's feet. And with time, their upper face has aged slowly, but then their lower face has continued to age at a faster rate, resulting in a really unnatural look. So don't be that person with the forehead of a 25-year-old and a lower face of a 60-year-old. All good injectors will talk you through a full face plan. And it's not just about us getting more money. It's so that you have a full face treatment plan and so that you age uniformly. Now, I'm not saying to do everything at once, especially if you're a first timer. It's perfectly fine to start with the upper face basics, but keep an open mind in the long run to treating other areas as well. Stepping into the world of Botox in your 40s can be both exciting and a little nerve-wracking, but knowledge is power. Now you know that Botox is safe, quick, and an effective way to soften wrinkles and refresh your appearance. I genuinely love seeing the boost of confidence my patients get from these treatments. Women in their 40s often tell me Botox made them look as vibrant on the outside as they still feel on the inside. The goal is never to change who you are. It's to refresh and enhance your natural beauty so that you look like you, just a little more refreshed. When done thoughtfully, Botox will have people saying, "You look great. Did you change your hair? Did you go on vacation?" rather than, "Did you get any work done?" Thanks for watching.